Welcome back. So a little more than a week ago, we ran a story about a woman in Gilbert who is choosing to treat her breast cancer naturally, which means without the use of conventional treatments like surgery, chemotherapy, or radiation. I have to say, never before has one of my stories created such polarized reaction. I have lost count of the number of emails, Facebook messages, phone calls, you name it, that I have received from people either in full support of what Tarly Reed is doing. A lot of you want to know more about it. Others are so adamantly against it, they have gone so far as suggesting she start writing her obituary. As promised, we are following her journey. We're continuing this discussion about healthcare and choice. We wanted to talk to a naturopathic oncologist to get his thoughts. Dr. Dan Rubin is a well-known naturopathic oncologist here in the Valley. He treats patients using naturopathic methods, but also works with other doctors for a more integrative approach. Neither, he says, is necessarily better than the other.
The data and clinical experience of myself and my colleagues in general for, say, somebody with an early stage breast cancer demonstrates that the naturopathic or non-conventional approach is not superior to, say, surgical intervention. That's an important one because we are met with that quite a bit. Women who are declining surgery and opting for a naturopathic approach.
When I asked him specifically about Tarly Reed's case, he said this, quote, "I can tell you without doubt that the overwhelming majority of women with primary breast carcinomas who do this type of treatment do not do well, and their tumors spread." He went on to say others do just fine as long as they are on the appropriate program.
We have a lot of tools at our disposal, and it really depends on the condition of the patient. How sick are they? What type of cancer do they have? Have they had any conventional treatments, and have they gotten sick from that? Or are they sick because of the disease?
He says it really depends on the type of cancer, and he doesn't know enough about her case specifically to say anything beyond that. So again, yeah, it's very interesting, and he hasn't seen her, he's not treating her, so he's not going to talk specifically about her case, but he says it's really important to understand the difference between the language that's out there now. There's alternative and then there's integrative. Integrative will use some of those conventional treatments and then also work in some more naturopathic remedies. So he says they're actually seeing a big increase in the number of people who want to blend the two and try to maybe change their lifestyle, change their diet, but then also be a little bit more aggressive with the other treatments.
And you're still following her. She's still going to call you with updates.
Yeah, we're keeping in touch online right now. She's in Costa Rica. And again, a lot of you reached out very angry about the fact that we ran her story. It's an interesting story, and of course, we wish her the best, and she's concerned too. She's like, I want this to work, obviously, but we'll have to wait and see what happens with her.
And she's in Costa Rica getting treatments.
It's a plant-based treatment with people down there, so she should be. We don't know when she's going to be back, actually. We don't know how long that's going to take.
Okay, we're going to keep tabs on it for sure.